Thank you so much for an amazing presentation. These webinars are actually the perfect platform where the patient organizations and patient voice comes first, always. And I love the saying, I even made a note of it, that nothing about us without us. It's actually amazing. And I love it a lot. So you have talked about the process, how we have created this charter and where we can find it. I do believe that it's very important for the patients, something to have, something to grab on, to have some legal grounds for their rights. What is your experience up until now? What is the daily life applicability of it? How do you see it being put in usage, actual, by each patient that is today taking part in the webinar?
So as I said at the beginning, some of the rights looks unachievable, right? Like, because we have patient organizations from El Salvador to the US, right? All the range from low, middle income, high income countries with different access to urticaria care. So, but we have seen very successful the implementation of these charters. We have done so with severe asthma, with COPD, eosinophilic driven diseases, and not only used by patients, but also new publications will use them as a reference. So that will be the gold standard set that they use when they want to, for example, talk about quality standards in whatever disease, right? So, so that's how scientifically it's used, the charter. But then the patients use that to go to policymakers and say, I want this for my community. Like, and this, I have number 1 and number 5. How can we do number 2 and number 3? But that's something that it has to be obviously work in collaboration with scientific societies and really do that very hard work of advocacy to policymakers, policy changers. And obviously, it's difficult to change access in the health system, but it's achievable. We have done it. It takes a long time, but it's achievable, and we have seen results. And this document is something that can be used as a base for what do you want to achieve, the minimum that you want to achieve as a patient.
I do believe that this document is meant for success, and I do hope that with these type of webinars or the tools that we're discussing further on today, we'll be able to contribute at least a little bit towards the implementation of these goals. So we'll get back to the charter once again a little bit later on, and I would like to give the word further on to Kristen, and she will tell us a little bit more about the CSU shared decision-making tool.
Thank you so much. It's such a pleasure to be here today, and always a pleasure to work with this team and to follow my colleague Victor when presenting. It is always nice. And I echo Victor's sentiment in that we are sending our thoughts to everyone who knew and cared for Marcus, and that we are dedicated to his legacy and ensuring that we continue the work that he started and sustaining that passion. So again, thank you for having me. I'm Kristen Willard. I am the Vice President of Education at GAAPP. Today, I'm going to talk to you about the chronic urticaria shared decision-making tool. I'm sorry, I'm losing my voice a little bit. So let's start with a definition of shared decision-making. The one on the screen is the very technical definition, but I think you can think of this as a process in which a patient and their healthcare professional, their doctor, they act as a team. So the person with CU brings their values, their preferences for treatment. They clearly talk about how the disease impacts them, both as physically and, as Victor referenced before, how it impacts their mental health, as well as what's really important to them as far as treatment and management are concerned. And with the provider's input, because again, you're working as a team, the name is shared decision-making. They come then to a shared decision about next steps, about what a tailored treatment plan would look like for that particular person with CU. So let me tell you a little bit about benefits of shared decision-making. There are many. The literature shows us, this has been demonstrated, that there are many benefits to this, tangible benefits. These are the reasons we engage in this process, even though it takes extra time, because it does. That's the one thing that people will say, but this takes time. And what we say is that extra time is worth it. So just a couple of the benefits, and I'm sorry, I see one of the slides is a little off. An improved relationship with your healthcare team. We see that the satisfaction is on both ends, that both the provider and the patient both experience increased satisfaction and an improved relationship when the shared decision making is adopted and becomes part of the care process. One of the most important things is the improved adherence to treatment regimens. It is hard to do anything on a regular basis. It is hard to floss your teeth. It is hard to remember to take your medication. Anything that can help that process and get us to a place where we are adhering as optimally as possible is beneficial. And this is something you can do that has that nice sort of side effect to it. And it was so important. It looks like it's mentioned twice. Better health outcomes. This has been demonstrated as well. We see better health outcomes for those patients who engage in shared decision making with their providers. So this is a no-brainer. It is worth the extra time. So exactly what does this look like? And this is a little bit technical too, but I do want to cover this. So this is from the literature that talks about the essential elements of shared decision making. The first thing sounds kind of obvious, right? But acknowledging that a decision is required. In this case, for a patient with CU, it would be how best to manage your chronic urticaria. What do you and what do your healthcare team think that could look like for you? Next, knowing and understanding the best available evidence, what is out there, not only in the literature about and the guidelines about best treatments, but also the best evidence that you have about how you know your body and what you experience. And as you might imagine, I think this is the part that probably takes a lot of time for people, right? To discuss that evidence, to discuss the options, but the shared decision-making tool can help to take some of the time out when you're in the office or you're on video with your provider. And what I think of as the most important, ensuring that the patient's values and preferences are considered in any decision. Just as Victor said before, I love that image that you have, nothing about us without us. For too long, that was the case. Now, we must have our input into the decisions that are made about our health and what we are asked to do moving forward. So we are so excited to share that we have the chronic urticaria SDM tool that was developed based upon this knowledge that there is a gap in care in chronic urticaria that we can fill, right, by utilizing shared decision making and the need for this kind of tool in our community. We are happy to tell you that an updated version of the tool, it's been revamped, will be launching on October 1st for World Urticaria Day. So we're so pleased about that. You can find this on our website. I'll make sure that a QR code is also available, but I often find that people will Google things very quickly to find them. And so if you Google GAAPP, it's GAAPP, and shared decision making, it will be your first result on that page. So let's talk a bit about what completing the tool involves. So it's obviously presented in a much more stylish way than you see on the screen. But what I wanted to give you an idea of was a sampling of the questions and what you can expect to see on the page. So when you go to the page, we encourage you to create a free account. If you create an account, this enables you to save your progress. You can take a break and come back if you'd like to, and also to save your report that's at the end of the document. So if you are willing to, we encourage you to do that. Now, after you enter the tool, you'd spend about 10 minutes, I'd say, answering questions about all of the different parameters that you see here. You can spend more time on it if you want, and always return to it, like I said, but sometimes it's nice to do in one sitting because it'll take about 10 minutes to do. I think it's important too for me to tell you that you can do this on your phone. If you have a modern smartphone, a laptop, of course, or your computer. So what are the questions? So the questions are about what your CU looks like, right? Do you have angioedema? How often are you having hives? How your symptoms impact your quality of life, how they impact your everyday functioning, because, and I know this as a CU patient myself, we can say that they dramatically impact our functioning. So let's take a moment through this tool to say on what things, on what parameters, what elements are most impacted. Is it hard for you to wear clothing? Is it hard for you to do everyday activities? Those types of things. We also made sure to include text that gives you a background so you understand exactly what we're asking about. It can be confusing sometimes when maybe your physician doesn't call it angioedema and calls it swelling, but you'll be sure to know here what we're talking about. And things are written at a level that will be accessible for almost anyone using the tool, we hope. So all of this information then will be documented for you. I think you can probably think of more benefits, but I can think of two that are two things that stand out to me, reasons why it's beneficial to spend that time doing this and then having your report and then sharing it with your healthcare provider, your doctor. And the first of those things for me is when we go to the doctor, I think it's very easy to forget things that we meant to talk about. So I will have a list in my head. There are 5 things. I will try to remember those 5 things, and I usually will remember about 3 of the 5. So what we want to do here is take all the things that you possibly would think to discuss and make sure that they are covered here. And we got to that point by creating the update, with a group of physicians, with, of course, patients and patient advocates. Everyone had input into this from that group, gave us feedback, and this is ultimately what we came to. So we thank everyone who was involved. There's some people on this call who were involved in that process, and we appreciate that because we know then that we're representing what it is that someone in the real world, so to speak, will find helpful. I think the second benefit that I would mention is in most of my doctor's appointments, and you may feel this too, I feel like there's never enough time. I could spend another 15 minutes that just does not exist. My urticaria or my other chronic conditions. And what the report does is it enables your physician to have a great deal of information about your condition, about how it impacts you, about your preferences for treatment, etc. And they can review that in a short period of time. So you can then have the shared decision-making discussion via that report. And so lastly, I just want to briefly talk to you about the report itself. So after you take those 10 minutes, after you complete the questions and you're sharing your personal experience, it will generate a report that looks similar to this. So this is the exciting part of the process when you can see it all represented there. Excuse me. At this point, you can print the tool, and you can also email it to yourself. So you'll have that copy. And again, I think it's really important. I know we're in an age where many things are digital, but it can be very effective to have a printed copy in your hands to share with your healthcare team and also to discuss. So we then encourage you to take that report to your healthcare professional. It can also be a nice tool to talk about your chronic urticaria, your angioedema, your hives with your family, if that's something that interests you. Sometimes that can be a hard discussion to have, right? This is how my illness impacts me. You don't really have the words to describe it in some cases. And this can help you to start those conversations and to show people really how this disease impacts you and what is most important to you in managing it. So October 1st is the day. We are thrilled. We encourage you to give this a try and to talk about the shared decision-making process with your doctors, explore it with your physicians. And again, it will take a bit more time, but don't be nervous about that. It most definitely, as we have seen via the slides and the data that we have, it's most definitely worth it in successfully managing your CU. So thank you so much for inviting me and allowing me to speak about this. We're just thrilled about its potential.
Thank you so much. It's always a pleasure to have you here on board with us. It's a great tool. And I do encourage everyone on the call to try it out, to access it and see how is it serving for you. And I have one question for you, and at the same time for all the patients that are now on the call. So please be sure to leave your answers, notes, or anything you feel like in the question and answer box. But the concept of shared decision making, the patient-centered approach, has been circling in the medical community for a very long period of time. Still, however, up to this day, when we put the patient in the center and we ask them, so what do you feel like? What would you like for yourself? They feel a little bit overwhelmed because they are so used to having others making decisions for them. And my question that would serve me also greatly in my daily practice: what could we do? What is necessary for patients to actually feel empowered or to feel ready to be on the same level while making decisions together with the healthcare provider?
That is $1 million question. And so I think that there will be differing viewpoints, patient to patient and physician to physician, right, about what might work for them. I think the openness in communication and setting the stage for your patients, that this conversation is welcome, right? That I invite you to be a partner in your care can go a very long way. So tools like this can be very helpful after that door has been opened, but it must be opened in order for this to be successful. So that, as a patient, is my perspective. I'm so interested to hear other people's perspectives on what they think might be most helpful.
I am very interested and eager to learn it too. So please, as we discussed, it's a very personalized approach. So whatever feel like would help you to feel more empowered or more fit to be able to make the decisions about your health for you, please type at us in the comments and we'll see how we can support you along this process. And now we're shifting a little bit to the other side. We are trying to find out how you as patients could help actually your doctor, because we as physicians also sometimes need a little bit more help, a little bit more support from your side to help you make the best decisions for your health. So Frank, the floor is yours.